Imagine closing your eyes tonight in the same position you've slept in for years, believing you're resting when in reality, you're slowly starving your brain of oxygen. No pain, no warning, just silent damage accumulating night after night. And when the symptoms finally appear, confusion, memory loss, dizziness, balance problems, the damage may already be permanent. Your family notices before you do. They see you struggling to find words, losing your balance, forgetting conversations from yesterday. This is not rare. This is not dramatic exaggeration. According to neurological research, nearly 4 out of 10 adults over the age of 50 sleep in positions that significantly reduce blood flow to the brain, and most of them have no idea. In the next few minutes, I'm going to show you exactly which sleep positions are destroying your brain health, why this becomes critically dangerous after 50, and most importantly, the exact setup that protects your brain while you sleep. What you're about to learn could prevent strokes, cognitive decline, and years of neurological suffering. My name is Dr. Charles Bennett, and I've spent over 2 decades studying brain health and cerebrovascular function in older adults. If you're over 50, this message is not optional. It is essential. Here is something most people don't realize. Your brain weighs only about 3 pounds, roughly 2% of your body weight, but it demands 20% of your total blood supply. Every single minute, your heart pumps nearly 1 liter of blood to your brain. That blood carries oxygen, glucose, and nutrients that keep 86 billion neurons alive and functioning. But here's the critical part. Unlike your muscles, your brain has no ability to store energy. It depends entirely on continuous blood flow. If that flow is reduced, even slightly for prolonged periods, brain cells begin to suffer. They become stressed, inflamed, and eventually, they die. And dead brain cells do not regenerate. This is why sleep position matters far more than people realize. During sleep, your body enters a state of repair. Your heart rate slows, your blood pressure drops, and circulation naturally decreases. This is healthy and normal, but only if your sleeping position allows blood to reach your brain efficiently. When your head, neck, or spine is positioned incorrectly, blood vessels become compressed, kinked, or twisted. Blood flow to the brain slows down. Oxygen delivery decreases. And over the course of 7 to 8 hours, night after night, year after year, this creates cumulative neurological damage. After the age of 50, this becomes exponentially more dangerous. Your arteries lose elasticity. The vessel walls become stiffer, less able to adapt to pressure changes. Plaque buildup narrows vessels. Blood pressure regulation becomes less reliable. Your body's ability to sense and correct low oxygen drops significantly. Your nervous system is less resilient to stress. In simple terms, your brain has far less margin for error. A sleep position that caused no harm at 30 can quietly destroy brain function at 60. Now, let me show you the most dangerous sleep positions, the ones that silently cut off blood flow and damage your brain while you believe you're resting. The first dangerous position, sleeping flat on your stomach. When you sleep on your stomach, your head must turn to one side or the other to breathe. This forces your neck into extreme rotation for hours. That rotation compresses the vertebral arteries, the major blood vessels that run through your cervical spine and supply the posterior part of your brain, including the cerebellum and brainstem. These areas control balance, coordination, heart rate, and breathing. A study published in the Journal of Neurology found that prolonged neck rotation during sleep significantly reduces vertebral artery blood flow, especially in adults over 50 with cervical spine degeneration. I treated a 63-year-old woman who had slept on her stomach for decades. She began experiencing chronic dizziness, difficulty walking straight, and episodes of vertigo. Imaging revealed reduced blood flow in her vertebral arteries. The cause was her sleep position. Within 3 months of changing positions, her symptoms improved dramatically. Sleeping on your stomach also increases pressure on your lower back and strains your neck muscles. It forces shallow breathing and can worsen sleep apnea. If you currently sleep this way, this is the first habit you must change. The second dangerous position, sleeping with your head elevated too high. Many people stack multiple pillows under their head, believing this prevents snoring or acid reflux. But when your head is elevated excessively, your neck bends forward at a sharp angle. This kinks the carotid arteries, the main vessels that supply the front of your brain. Blood flow slows. Oxygen delivery decreases. Your brain compensates by increasing blood pressure, which stresses the cardiovascular system. Large studies from sleep research centers show that improper pillow height contributes to morning headaches, brain fog, and long-term cognitive decline. One of my patients, a 58-year-old man, used 3 stacked pillows every night. He complained of waking with severe headaches and mental slugness that lasted for hours. We adjusted his pillow height to maintain neutral neck alignment. Within 2 weeks, his headaches disappeared. His energy returned. Proper pillow height is not about comfort. It is about vascular health. The third dangerous position, sleeping with your arm under your head or pillow. This is extremely common, especially among side sleepers. When you place your arm under your head, you compress the brachial plexus, the network of nerves running from your neck to your arm. You also compress blood vessels in your shoulder and neck. This reduces circulation not only to your arm, which causes numbness and tingling, but also indirectly affects blood flow returning from your brain. Additionally, this position creates uneven spinal alignment. Your shoulder collapses inward, your neck tilts at an unnatural angle. Over time, this contributes to cervical spine degeneration and chronic tension that further restricts blood flow. I remember a patient who woke every morning with a numb arm and a stiff neck. She dismissed it as normal aging. It wasn't. It was positional vascular compression. Correcting her sleep posture eliminated the problem within days. The fourth dangerous position, sleeping without proper neck support. Some people use flat pillows or no pillow at all, believing this is healthier for the spine. In reality, the cervical spine has a natural curve that must be supported during sleep. When your neck is unsupported, muscles strain to hold your head in place throughout the night. Blood vessels running through tense muscles become constricted. Blood flow decreases. You wake with neck pain, stiffness, and reduced mental clarity. Research from orthopedic and neurology journals confirms that neutral spinal alignment during sleep is essential for optimal circulation and neurological health. Now, let me explain exactly what happens inside your brain when sleep position restricts blood flow. This is where the real danger lives. Step 1. Reduced oxygen delivery. When blood flow slows, oxygen levels in brain tissue drop. Neurons begin operating in a state of chronic stress. They cannot perform normal functions efficiently. Step 2. Metabolic waste accumulation. During sleep, your brain clears out toxic proteins like beta amyloid and tau, proteins strongly linked to Alzheimer's disease. This clearing process requires healthy blood flow. When circulation is impaired, waste accumulates. Over months and years, this toxic buildup damages brain cells permanently. Step 3. Increased stroke risk. Compressed arteries create turbulent blood flow. Turbulence damages vessel walls and increases the risk of clot formation. A clot in a narrowed artery can cause an ischemic stroke. Step 4. Cognitive decline. Repeated nights of poor circulation accelerate brain aging. Memory weakens. Focus deteriorates. Decision-making becomes slower. Step 5. Balance and coordination problems. Reduced blood flow to the cerebellum affects your ability to walk steadily, react quickly, and maintain equilibrium. This increases fall risk, which is deadly in older adults. Let me share a case that still haunts me. A 67-year-old man came to me complaining of worsening memory and frequent dizziness. His wife said he seemed confused in the mornings. She was terrified. She told me, "Doctor, my husband is disappearing. He forgets our grandchildren's names. He stumbles when he walks." Standard tests showed no obvious disease. But when we discussed his sleep habits, I learned he slept on his stomach, with his head turned sharply to the left every night. We performed vascular imaging. His left vertebral artery showed significant compression during neck rotation. I advised him to change his sleep position immediately. He resisted at first. Change is uncomfortable, but his wife insisted. 6 months later, his cognitive symptoms had improved measurably. His dizziness stopped. His memory sharpened. He told me, "Doctor, I thought I was losing my mind. It was just how I was sleeping." His wife cried tears of relief. The good news is this: you can fix this tonight. You don't need expensive equipment. You don't need medications. You need awareness and the right setup. Here is the brain-safe sleep system. Step 1, choose the right position. The best position for brain health is sleeping on your back with proper support. This keeps your spine neutral and blood vessels open. If you cannot sleep on your back, sleep on your side with correct alignment. Never sleep on your stomach. Step 2. Select the right pillow. Your pillow should support the natural curve of your neck without pushing your head too far forward or letting it drop backward. A general rule: when lying on your back, your head should be level with your spine. When lying on your side, your head should align with your spine, not tilt up or down. Memory foam or cervical support pillows work well for most people. Step 3. Support your entire spine. If you sleep on your back, place a small pillow or rolled towel under your knees. This relieves pressure on your lower back and maintains spinal alignment. If you sleep on your side, place a pillow between your knees. This prevents your upper leg from pulling your spine out of alignment. Step 4. Avoid tucking your arms under your head or pillow. Keep your arms at your sides or resting gently on your chest or stomach. This prevents nerve and vascular compression. Step 5. Create a sleep environment that supports brain health. Keep your bedroom cool, ideally between 60 and 67 degrees Fahrenheit. Cool temperatures improve circulation and deepen sleep. Ensure complete darkness. Light disrupts melatonin production, which is essential for brain repair. Now, I know changing sleep position after years or decades is not easy. Your body is trained. You will wake up in your old position at first. That's normal. Here's what you do. When you wake in the wrong position, gently reposition yourself. Do this consistently. Within 2 to 3 weeks, your body will adapt. You can also use positional aids. If you tend to roll onto your stomach, place a body pillow along your front. If you tend to stack pillows too high, measure your pillow height and adjust deliberately. Let me summarize the 4 dangerous sleep positions that damage your brain. 1. Sleeping on your stomach with your head rotated. 2. Using excessively high pillows that kink your neck forward. 3. Placing your arm under your head or pillow. 4. Sleeping without proper cervical support. Each one restricts blood flow. Each one accelerates brain aging. Each one increases stroke risk. And each one is completely preventable. Your brain is the control center of your entire life. It holds your memories, your personality, your ability to move, speak, think, and love. Protecting it is not optional. Sleep is supposed to heal you, not harm you. If you are over 50, tonight is the night you take control. Adjust your pillow, change your position, protect your brain while you rest. Before you leave, I need you to do something powerful. First, subscribe to this channel. Every week, I share life-saving brain and heart health information designed specifically for adults over 50. Second, like this video. It helps this message reach others who don't know they're at risk. Third, leave a comment. Write, "I'm fixing my sleep position tonight." Your commitment may inspire someone else to act. And finally, share this video with someone you care about. A partner, a parent, a friend. You may never know whose brain you protect. Sleep should protect your brain, not damage it. Take control tonight. This is Dr. Charles Bennett, and I'll see you in the next video.